I'm Monica Morrow, Chief of the Breast Service and Ann Burnett Winford Chair of Clinical Oncology at the Memorial Sloan Kettering Cancer Center in New York. So microscopic disease in the underarm or axillary lymph nodes is something that helps us to predict the outcome of breast cancer based on how much microscopic disease is actually there. And that's not normally something we can tell from just doing a needle biopsy of the lymph nodes. So in the vast majority of women who have invasive breast cancer, sentinel lymph node biopsy, a procedure to remove the first lymph nodes that cancer cells would go to when they're leaving the breast, is a routine part of surgical care. Once we take out those lymph nodes, we can then see exactly how much disease is in the nodes. A micrometastasis refers to a very, very small amount of cancer in the lymph node, less than or equal to 2 millimeters, which is about 1/16 of an inch. That's very different than patients who have larger amounts of cancer in their lymph nodes, where that indicates an increased risk of cancer coming back elsewhere in the body, and potentially an increased risk of cancer coming back in the armpit, which requires surgical removal of more lymph nodes. For micrometastases, we know from randomized trials that have involved large numbers of women that taking out all the underarm lymph nodes is not necessary. It doesn't improve the chance of surviving breast cancer. The risk of cancer coming back in the area of the underarm lymph nodes with only removing the sentinel nodes is quite small. It's about 1%, which is no different than what we see if we remove all the underarm nodes. But what is different is you have far fewer side effects after only a sentinel node biopsy compared to removing all the lymph nodes. And the most important of those side effects is lymphedema or arm swelling, which we see in about 25% of women who have all of their lymph nodes removed, and we see in fewer than 5% and probably fewer than 3% of women who have only sentinel lymph nodes removed. So complete lymph node removal is not necessary for the finding of micrometastases in the lymph nodes. And similarly, we don't routinely give radiation or chemotherapy just for the finding of these micrometastases. They're considered as part of the overall picture of breast cancer.